Tonight, I have two very special guests that are going to talk about something a lot of women deal with. Candace Kessler and Dr. Natasha Denny. So excited to have you fabulous ladies on the set. And we're going to talk about something that's very important because men struggle with certain issues and there is help for these men's issues when it has to do with sex and lack of or prevention of. For women, something that a lot of women experience is vaginal dryness. Sometimes there's really no help for that. Sometimes there's estrogen that might help, progesterone that might help a little bit. But now there's something new that is on the scene that you have been seeing great results with, Candace. Let's talk a little bit about that tonight.
Yes. So I'm the nurse practitioner at the Center for Women's Aesthetics. We specialize in a procedure called Mona Lisa treatment. It's a vaginal CO2 laser that helps with dryness and atrophy and helps build collagen in the vaginal and vulvar area.
So I'm going to ask you a quick question.
Sure.
So there was a procedure that came out, I don't know, probably 4 years ago called the O shot. Mm-hmm. Are you familiar with that?
I am.
And how is the O shot different than what you do?
So O-Shot is using platelet-rich plasma and being injected, and it is primarily for sexual function and enhancement. The Mona Lisa is used to treat symptoms of menopause that all women go through as their estrogen levels go down. The loss of elasticity in the tissue, the dryness, which often comes with painful intercourse. We also use it to help with urinary symptoms like urgency, frequency, incontinence. We have a lot of patients who use the laser because they are not allowed to use estrogen for cancer history and things like that. Absolutely. And so it's a really safe alternative to hormone replacement and can also be used really well in conjunction with that.
So Dr. Denny, I'm going to throw a question to you. You know, you have been at OBGYN for so many years, and so, but you're only 30, so I'm not sure how that is. But, you know, one of the symptoms as you age and as you go through the menopause, perimenopause, menopause, is the vaginal dryness. And I'm sure you get frustrated because you become one with your patients. You're just that doctor that really, you just embrace all of the issues and problems and you feel them. It's probably been very stressful to you to not be able to have a resource for this, because I can remember you being very excited about this new procedure and Candace coming into the practice.
Yes. Well, basically vaginal dryness, unfortunately, women are afraid to talk about these things, and so I'm really happy when they actually open up, when they come for their exam and they say, well, this is what's happening. I feel dry. It feels like sandpaper down there, sometimes very, very painful intercourse, and a lot of times their husbands are the ones who's directing it because they don't want their wives to hurt during intercourse. It used to be something that might have been very pleasurable, and then now it's creating a rift in their relationship. So we did have creams, estrogen creams that are available. Some women are afraid to use them for, like Candace explained, for cancer risk, or just people don't really care for hormones for various reasons, which we're trying to, that's a whole other show that we need to talk about. We're trying to bypass that. But at the same time, for whatever reason, if you don't want to do a cream or they have some over-the-counter medications that are water-based or vitamin E, coconut oil, they just don't work as well as the resurfacing of the vaginal wall, which is what the Mona Lisa laser treatment does.
And I love the name, the Mona Lisa. Yes. So the procedure takes about how long?
So it's a very quick thing. You come into the office, we let you sit with some numbing cream for about 20 minutes, but the laser procedure itself takes about 5 to 7 minutes. Minimal discomfort. We treat the entire length of the vagina, 360 degrees around, and you feel a bit of a kind of buzzy sensation and some pressure. And then we also treat externally along the vulva to help build elasticity in that tissue and bring more blood flow to the area.
So, and how long, does it one treatment or multiple treatments?
Great question. So it's initially a series of 3 treatments. We space them out about 6 weeks apart. And then the clinical studies tell us that the results of that laser start to decline around 12 months. So we have patients come back once a year for a kind of a maintenance session to maintain all the good work that they've progressed with.
And so it's relatively new.
Fairly new. So Mona Lisa's been out almost 20 years now. It originated in Italy and has been FDA approved in the U.S. for about 15 or so maybe. It's definitely become more in vogue and more popular. And in addition to having a lot of OBGYNs refer to us now, we also see a lot of patients that are self-referrals or have heard from friends about the technology. And it's just so important for people out there to know that it exists because there are good, effective results.
And does insurance cover this?
Unfortunately, no. So there's no.
They don't care about our sex lives, right?
I know. I hate that for patients. We do have a lot of patients that use like HSA and flex spending accounts that their insurance can do, and we provide them with a letter saying that they were doing this for a medical purpose.
Right.
If not, it's $18.99 for that
what is the cost
series
of that?
of 3 treatments. So $633 per treatment, and then maintenance session is $500. So when you kind of compare it to some of the costs of the medications, the vaginal estrogens, they're not, those aren't cheap either.
Right.
Yeah, and a lot of times insurance doesn't even cover that. So it's like, we're trying our best. Women's health needs a lot more attention, but, but for sure, if you have the Mona Lisa's touch, then that's something that can last for over a year. So, I mean, definitely it's cost effective.
Well, let's be honest. Insurance doesn't cover lasers on our faces.
Right.
And that's something that you get once a year. So it's no different than, except for the benefit might be a whole lot more, maybe perhaps.
And interestingly, it is the same type of laser we use on your face to help rebuild collagen and elastin. So I tell patients all the time that are so nervous about it, I'm like, you've done it to your face how many times? It's okay to do it to another party.
Right, exactly. Now, what are the after effects of it? I think the numbing sometimes can cause you to have a little issues after short term.
Mild discomfort. I tell people you can expect to feel like you've gotten a sunburn in that area for maybe 6 to 12 hours or so, but typically by 24 hours out, patients are back to normal life activity. There's a little bit of downtime in terms of strenuous exercise and intercourse, but I mean, you go back to work the next day, you're totally fine.
The vagina heals really, really well. So, that mucosa is just, it's like super healing. So it doesn't take a long time.
So now practice is going to start this in January, or you've already started it? Bringing
We
it on board?
have been actually doing Mona Lisa at the Center for Women's Aesthetics for close to 8 years now.
Okay.
It's been around a long time. We have over 98% success rate in patients' relief of symptoms.
Right.
And we've had no reported complications. It's a very safe and effective procedure.
For some reason, I thought it was new to your practice starting in January. So you've been doing it this long. Okay,
So
I
it's been
misunderstood.
available for all this time.
Oh.
But it's just a matter of getting the word out that it's available and to be able to refer the patients to
I
the
got
center.
you. I love this. I think that we talk about so many things, even on this show. And like oftentimes a sexual pleasure sometimes is taboo, but I think it's more accepted now because there are so many things are accepted, and it's a way of life.
It is.
Like, when you have the vaginal dryness, like, you're not happy and the husband's not happy, the partner's not happy, and this is a way of changing all of that, and it's relatively easy and relatively inexpensive.
The thing is that there's so many products that are available for men who have like erectile dysfunction and things like that. So then you have so the men are good, right?
They're good.
Right? And then, you need to just have a partner who is not, in pain. Like, I mean, these vaginal dryness, it's not just dry, it's painful. And, and once they don't want to have intercourse, it's going to affect their mind, and then they're going to associate the intercourse with pain, right? So we're trying to get it back to, again, like when it was pleasurable, because it may not have always been like that. So
I think there's a certain amount of endorphins too when you are satisfied, and I do. I think that it makes you happy in general.
Absolutely, there's research that shows that. Absolutely,
Amen to that.
Longer quality of life and happiness. I mean, there's so many studies, like you said, that this, everybody, the whole unit needs to be happy.
Right. And I think it's full circle because, like this is something that women's aging, it's like, it used to be you're a certain age, you're like, it's done. And now it's like, there is no age limitations. I mean, certain things, you're not going to have babies at a certain age. You're not going to, there's certain things that
So that's why it should be even more pleasurable, right?
Exactly. No worries.
Exactly. You're not worried about having children, so you can just be happy and enjoy your life and enjoy your relationship, you know?
And it has to be rewarding for that patient that has had the procedure done and comes in and tells you, oh my gosh, it was like, number one, relatively easy procedure. Right. Number two, like I can tell a huge difference in how I feel and the no longer painful sex. Right. And
then, like Candace was also saying, that sometimes there's things like on the vulva that get treated, like there's certain skin conditions, or lichen sclerosis, for example, which is something that causes like painful white lesions on the vulva, and the laser can treat that as well. And then that that's another thing that can lead to pain, but this can also treat that too. That's a good thing.
Lasers are beautiful, and they're getting better and better and better. And the Mona Lisa sounds like it is the cat's meow. So I just want to wrap it, just saying. No pun intended. Sounds good. So 3 procedures. So for most people, you use 3 procedures, and it helps with vaginal dryness, and it can help with bladder.
Right.
That's off label, but it could possibly
Absolutely.
help with that. And then once a year, possibly every other year, ever how, each
whatever
patient's different.
patient needs.
Right, maintenance.
Yes.
And $18.99 for 3 procedures.
Anything that brings moisture to the vagina will help the bladder. So.
Okay. Well, thank you, fabulous women tonight. And Dr. Denny, you're always such a delight. When we had you on the show the last time, I got so many emails because you're just such a natural.
Aw.
You speak so easily, and you make everybody understand, the basics of it. So I love that. And thank you so much, Candace, for stopping by the set. We're
Thanks
so
for
excited.
giving us the chance for women to understand more about their bodies. That's what we're here for.
I love it. Thank you, ladies, so much.
Thank you.
So the Mona Lisa, it can help you in many ways, and it can also bring us. Mona Lisa may not be smiling, but you will.